Hello guys, it's me again, Audrey, a medical student from the Philippines. And now you are with me as I start the second bi-monthly write in second year. So right now, today is still a Sunday, and now we're already given a case. And this case says that there is an anterior mass in the neck. So right now I am making notes and reading hyperthyroidism, which could be one of the differential diagnoses. But you know, there are a lot of differential diagnoses for an anterior neck mass, but this is what I start with, and let's try to go over it. Risk factor is minor risk factor in Graves' disease and a major risk factor in ophthalmopathy. Causes of hyperthyroidism in Graves' disease. Thyroid stimulating TSI are synthesized in the thyroid gland as well as in hormones. Hey guys, so today is a Monday and I just finished writing all the things that I need to do for the rest of the week, since we are given weekly calendars and also a monthly calendar, as you can see over here. For this morning, today is IS, or independent study time. So that would mean that we are given time for us to read the trigger question or the trigger case that was given yesterday or yesterday or pag Sunday. So it was a case of somebody who has an anterior neck mass. So later on, we will be asking questions to this patient. If the patient is female, the patient is around 20 to 50 years old, which is usually seen in patients with hyperthyroidism. So our SGD will be for handout 1 to 3. So that is from asking the history, and then more history, like the family history, social history, and lastly, you will be actually seeing the PE. Propyluracil side effect is hepatotoxicity. That's why you need to check the liver function once you are using propyluracil. Propanolol is used for the propanolol or atenolol is helpful for the sympathetic nervous system side effects of hyperthyroidism. Maybe you have adrenergic symptoms, especially in the early stages before thyroid. Anti-thyroid drugs take effect.
Before we start, ako have a question. What is meant by anterior neck? Hello?
Anterior neck is anterior to the anterior border of the sternocleidomastoid.
Take note also that the patient is female plus 30 years old, since if anterior neck mass, it can be a case of goiter, Graves' disease, and as far as I remember, Graves occurs more commonly between ages 20 to 50 years old. And
it's not enlarged, distinct S1 and S2, regular rhythm, tachycardic, no murmurs appreciated. So from this, again, as mentioned, as determined from the vital signs, we hear tachycardic, but there's no thrills or heaves of cardiac dullness.
For the cerebellar system, which we mentioned a while ago that it should be ruled out if it's in cerebellar in origin or an endocrine in origin. It's the cerebellar system is intact because there is well coordinated movements by finger to nose test and pronation and supination of both hands.
The pathology is the excess of hormones. So like what if there is a thyrotoxicosis not the case? So I'm considering primary toxicosis as my differential.
Can it also be like the toxic nodular multinodular goiter? I think this the same or ba na te sa imo ano
Oh, I think different din siya than
alahi siya no yeah.
Maybe we can, although
Um,
this is less likely, like super less likely good because the eye movements are still intact and there is no bitemporal hemianopsia. But then we can't rule it out unless the labs are present, manggod. So maybe we can still put into account the TSH secreting pituitary adenoma.
okay, I'm okay with that, Audrey. Okay, Audrey. So yesterday we were able to cover handout 1, 2, 3, and then from that we were able we raised a lot of learning issues that we will be tackling today, and
Old female, and then we wanted to know her occupation, her marital status, her pregnancy status, her address, her race, and religion.
Okay? So thank you very much and
thank you so much, Doc.
Thank you, Doc.
stay safe.
So we just finished the second day of our SGD. So what we did a while ago was to present the concept map and interpret the laboratory values, and we also talked about the cascading events after the patient went into therapy because there could be side effects of the medications as well. Hi, Nevin! Support the moms. Thank you.
Appearance of the vaginal bleeding in your hydatidiform moles is that it is described to appear as prune juice, commercial grape juice, like purplish, na watery. So this is secondary to the blood products becoming acidic, and then this will result in the oxidation and liquefaction of that blood. You were able to narrow it down to your hydatidiform mole. So moving on to the diagnosis, so Audrey will now take over this presentation. Thank you.
Hello, good afternoon, everyone. So, according to the diagnosis, first off, we have the serum beta HCG measurements. So, in the beta HCG measurements, there is a difference between a complete molar pregnancy and a partial molar pregnancy. And so, in a complete molar pregnancy, HCG levels are increased to the point that it's even it doesn't fall into the ranges for gestational age. And its values can lead to erroneous false negative urine pregnancy results. Whereas in your partial molar pregnancy, there is it's also elevated, but the concentration fall into the ranges expected for gestational age. Nikki mentioned a while ago, and there is also a presence of amniotic fluid, which is seen here as a big space of big anechoic space. But then there is also abnormally wide gestational sac and abnormally looking placenta. So there are 3 ways of managing a patient having hydatidiform mole. So you have suction curettage, hysterectomy with ovarian preservation, and lastly would be to monitor the HCG.
Okay? So bye-bye. See you next week. Okay? Thank you.
Thank you, Doc. Bye, Doc.
Thank you, Doc.
Okay, guys, so we just finished our last part of the SGD. So actually in the last part we have a lot of mini cases to answer. So it's still the same, such as a long SGD, but it has shorter time for us to answer all of it. So we had, I think, 4 cases a while ago, and later on we will be preparing ourselves for clinics. And in the clinics, it was also said and mentioned that the patient has fever and headache. So let's try to decipher that tomorrow.
Gikan di ay sa Cebu Institute of Medicine na aming mga pangutana para nimo karong adlaw tapos mag physical exam ka pag human sir, okay ra na sa imo sir?
Yes, okay ra do.
Una sa sir, unsa yung kumpleto natong pangalan sir?
So actually, I just woke up from a really nice and hopefully well-deserved rest after our clinic session a while ago. So as for clinics, it was great. I know that's not a descriptive word, but it was great, but it was also exhausting for me. So it was actually my first time in the first few bi-monthlies that in the middle of the week I had to sleep before studying again. Maybe it's because it was really draining, but it was also exciting because it was like interviewing an actual patient, and the doctor was also giving us really good feedbacks on how to approach the problem and how to approach the case properly the next time that we will be doing history taking. So right now I am studying for a TBL session tomorrow, which will happen tomorrow, and it's about thyroid pathology. So Vari occurs as a serous or mucinous cystadenomas, or I forgot the other one, teratoma. Okay, teratoma or serous or mucinous cystadenomas, partially recalled. Hey guys, that is it for this week. I just finished my TBL. So there are 2 parts in a TBL. You have the individual test and the team test. But what you will answer individually will be the same type of questions that you will be answering as a team, just like the collaboration of doctors once they are trying to diagnose a patient. So it's just like a real-to-life situation also. So I hope you learned something for today, and that is it for this vlog. Don't forget to like, share, and subscribe to this channel. And as always, live a life you'll never regret. Bye!